I don't you understand that formula? Girl, I'm addicted to you. I don't know what to do to me. I'm going to you give me trouble. And I'm back to the come to the road. Every day is beautiful. Baby, don't let us come to the party. And I want to tell about you. When I make my business cut, I want to be alone and it's a man. I don't need to worry as I know. I don't need to want to. I don't need to make it as I know. I don't need to my God. I don't need to worry as I know. I don't need to want to. I don't need to make it as I know. You know the way you're dancing, the way you shaking your body, they make me go crazy. Do you know how you're dancing? How you shaking your body, they make me go crazy. Girl, I want you formula. So you must be formula. You're looking for the formula. From here down to South Africa. You know I got the formula. I know you like the formula. You're looking for the formula. From here down to South Africa. You know I got the formula. I know you like the formula. Oh, I got the formula. Baby girl, see I love the formula. Them say everything makes you popular. Baby like the boss, I'm regular on the regular. I go like to give on the regular. I know my makeup, but she secular. That thing with the boss, I'm regular. Hey, I'm just thinking question my name. Baby girl, it's got on my brain. I'm loving the way that you shake, my lady. I'm just thinking question my name. Baby girl, it's got on my brain. I'm loving the way that you shake, my lady. Oh sweetie, I'm a sweetie, baby, I'm cool, stick my mula, do I get, I'll be back, oh, I got my go, I'll be back, oh, I got my I'm addicted to you. I don't know what you did to me. I want it till you give me trouble. And the time to the come to the it's beautiful. Baby, I get something about you. And I want to tell about you. When you get my business cut, I want to be alone and it's a brother. I don't need nobody can do it. I don't need you make it as I know. I don't need oh my God. I don't need nobody as I know. I don't really want to. I don't need you make it as I know. You know the way you dancing, the way you shaking your body, they make me go crazy. Do you know how you dancing? How you shaking your body, they make me go crazy. Girl, I want you formula. Sweet Diana, yeah, you must be formula. Colombiana, I know you got the formula. Sweet Diana, baby, you must be formula. Colombiana. You're looking for the formula. From here down to South Africa. You know I got the formula. I know you like the formula. You're looking for the formula. From here down to South Africa. You know I got the formula. I know you like the formula.
Boy, I didn't know that was not muted. Oh my God. Hope it wasn't making noise. I always drink water before starting. Wow. Let me see what the family members are saying. Woo! See, Obioma saying that so. Obioma is a lovely guy. He's a dedicated member of IOM family. I love you, darling. So we have Oya take water small. Yes, so listen, and Alma always smile. Come on, what do I do? Waiting again. If I no smile, waiting again. And then Chidera, I'm feeling the vibe. Wow, 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 wow. And Cheryl shows I love the way Nurse Angel done. Yes, and Chido, keep sharing. Chidoke has, yes, WhatsApp, WhatsApp. So on a quick note, I will, please, if you're watching, please take the link of the talk show and share on your WhatsApp page. I want to do it straight away because it helps. It helps a lot with people viewing us live. Where are we? Oh my God, where are we? Am I on the page? Okay, I'm now on the page. All right, so I'm quickly going to share the link on my WhatsApp status. Please, if you're watching, go to your WhatsApp status and share the link. Shared. It's just like a click. I've shared it. Fantastic. I'm going to send it to you, Lois. I know you keep asking me to send you the WhatsApp link, so the Facebook link, so you can share. I sent it to you so you can share on your Facebook or any status. All right. On that note, Chijoke said, Tochuku, cute song. We see you there. Yes. So on that note, I want to say to you all, good evening, farms. Good evening, family. Good evening, my lovelies. And thank you very much, Tochuku. I'm not Tochuku's son. I'm not talking like Chichi. Say Tochuku's son. Thank you very much, Michelle, for joining us live because tonight, we are talking about depression in children and young people. I repeat, depression in children and young people. So, first of all, I want to make an announcement. Parental guidance. Parents, if you're watching this program, this is the concluding piece of depression. Please, can you quickly get your young children, get, if you have any child in the university, if you have a young child, please quickly call them. Let me send message. Quickly call them to come to this live show. This is a very educative, interactive talk show, and is focused and centered on our children and young people. Please get them to come to the show. Let them watch it wherever they are. So I want to give a quick summary. We have some people waiting behind the scene. I want to give a quick summary. This, as I said, is the part three, concluding part of depression. In the part one, we have the consultant psychiatrists, Prosper Obioha, and we had our own Professor Temitope Peters. They came live to talk about depression in children. They talked about the causes, the symptoms, the signs, the cure, the treatment, and what have you. And in the part two, we had Ruby and Lois. Ruby and Lois shared their experience of depression. They said they were depressed. They diagnosed, that's called self-diagnosis, which we don't really advise. But they said their experience of depression. And this is the part three. The part three of depression in children and young adults. I want to, first of all, before I bring in our guests, I know the guests, they are watching behind the scene. I want to play with the family members a bit. This is what I love to do. But by the way, Michelle, can you show us your in our mind logger? Yes, this is what we love. We love children, anyone coming to the backstage. If you want to come, if you're a family member of In Our Mind, please can you quickly get yourself our polo, our um um our our t-shirt and anything that shows our logo. We need to continue to fly. Everyone needs to identify this within our mind. If you don't come up like this, like Michelle is doing, you're not truly flying and representing In Our Mind talk show. We need in our mind to go global. We are not lower than Apple. We are not lower than Mark. We are not lower than Nike. No, we are creating a brand. We need to showcase our brand all over the globe. And by showcasing it, this is exactly what Michelle is doing. Michelle, I want to specially thank you for wearing our polo to come live. So I want to play. Let me see what the family members are saying. You're right. That's Chima Gozigum, our in our mind most active for the month of January. Efosa, that's our trademark. Efosa is a staunch member of In Our Mind family. Ilusa say, I pray I have money. What do you mean by you pray you have? You cannot pray. If you like, pray for 1 year. You won't have money unless you work for the money. So I pray I have money next month to get my t-shirt. I seriously on my mind. I love that, Ilusa. Ilausu. Ilausu, I love the fact that it's in your mind to get it. I'm looking odd without it. But don't just pray, because prayer without working for it, you won't get the money. So work, work, work. And in your work, that is where you see the prayer in action. Thank you very much. And last time, we are having trouble streaming in LinkedIn. Get out. Don't they are giving me notification that they can't stream in LinkedIn or something. So Musa say ready to explore the world. Thank you. So on that note, family, you know I love you. I have people waiting at the backstage, but before they come, I want to engage you. I want to engage you by saying, can someone, family, can you tell me what does it mean when you are told to cope? When you hear the term, look, don't start quoting a long story about getting things from the internet. When you are told to cope, what does that mean? I just want one line, one sentence. Okay. Chidroke said to endure. That is what I want to hear. Speak, speak. What do you want to say?
To tolerate.
To tolerate. Fantastic. So family members, gift say to adapt. Fantastic. I like that. To manage. Cocastic. That is fantastic. Give us reaction. Oh, I don't know what she's talking about. Always in my mind. That's all I share. That's good. Princess said to endure. Thank you very much. Thank you. Coping is managing with the situation at hand. So when I say please, you need to cope, that means please manage, please endure, please. What did you say, my sweetheart Michelle? What did you say?
To tolerate.
To tolerate. Please tolerate. So that is what coping means. To cope means to keep hope alive. Fantastic. I love that. To manage, according to Kadisha. Fantastic. Now, family, I want you to tell me, when we say you need skills, what do we mean? Family, when we say you need to acquire skills, what do we mean? We have left to cope now to skills. When we say to manage and to acquire skills, you say to manage, you're still on to cope. I will mute you, sweetheart. I don't know where the song is coming from. I think it's from you. I've muted you. When you want to talk, you mute yourself. So what is, to be patient, that's coping. Now, what is skills? To deal successfully with the, okay, that's coping, Queen. So what is skills? Chichi, holistic, you can make one for yourself. We don't sell it. We can start, you can start selling it. So what is skill? To get something doing. Okay, fantastic. Ilausu. Yes, thank you. Bukola said to do with what you have. Okay, thank you. Rita, give us life and love reaction. Thank you. Just be giving us thumbs up, Rita. Mwah, mwah. I love you, Rita. Yes. So what does it mean to have skills? I'm having network issue. Yes. Oluwafemi said to have a basic knowledge. Absolutely. Thank you. Princess said learn a particular thing. Fantastic. That's to have skills, handwork. Fantastic. You're giving us an example. Hey, in our mind founder. I salute you. This is the owner of In Our Mind Talk Show. Thank you, In Our Mind founder. John said to learn something. Love you, John. I love you. Thank you. This is the meaning of skill. Now, what is life coping skills? Quickly, because some people are tired of waiting at the backstage. I want to bring them up. What is life coping skills? When you're told that you need life coping skills, what does that mean? What does it mean to have life coping skills? So can you sit still? I can see you, and I'm going to mute you all at the backstage. Tochukwu unmuted. I've muted you. Don't unmute again, Tochukwu. So what does it mean? I don't bring in new people, so we will not. So what does it mean to have life coping skills? To learn, acquire something you don't know. Okay. So what does it mean when I say to you, you need to get life coping skills to be able to endure and survive challenge of life with your knowledge? Chikina. Femi, thank you. Case closed. Hello. In our Mind Talk Show, we've closed for today. Tochukwu has just concluded the talk show today because today, which is a part 3 of In Our Mind Talk Show, we want to use this opportunity. Since we've talked about depression a lot in children, we want to give you life coping skill on how to avoid depression or on how to manage depression and on how to come out of depression. That is what we are here to do today. And I have missed a lot as I have been busy with a lot. Hi, Tochukwu, my wonderful guy. So to equip yourself with a handwork, thank you very much. And learning something that will never depart forever. Yes, but most importantly, I want to say that anyway, we'll leave it for our special speakers. So on that note, I want to introduce somebody to you. I want to introduce to you Maki. I want to introduce Maki more to you. Maki is a third-year digital marketing student at the University of Birmingham. She is currently on placement at Aerospace. Aerospace is all these airplane companies. And she works at the Business Operations Department unit. So Maki is here tonight, and I want to say to you that Maki is my own daughter. She's my one and only daughter, and she is here live and direct. That is Maki. Yes, Maki is my daughter. She is my second child, but only daughter. Although I've adopted one, so I shouldn't say only. She's my first daughter. I have an adopted wonderful daughter. She'll soon be joining me. Yes. So we want to see whether you're welcoming Maki. Welcome, Maki is a rich girl. Oh. You see this girl? She's my daughter, but she's richer than me. Maki is richer than me. I want to say this quickly to you. Maki is richer than me. When I wanted to buy a house, Maki gave me 5,000 pounds. Maki, more than you're seeing, started working in her secondary school. She's always working for schools and she was paid. In secondary school, Maki had thousands of pounds in her account. Sometimes when I'm broke, I will say, Maki, I'm broke. She will give mommy 300 pounds. In secondary school, now she's in university. She's working, and trust me, her salary is close to 2,000 pounds. So when I wanted to buy a house, Maki gave me, she's in third year university and she's working. Maki gave me 5,000 cool cash. Please, how much is 5,000 pounds in Nigeria? How much is 5,000 pounds in Nigeria? Wow, welcome there. That's Bleble. Lucia said that's beautiful. How much is 5,000 pounds in Nigeria? You guys can continue. So Maki is here to talk to us about coping skills. She will help us share with us some life coping skills and how to utilize it. Okay, I also have here behind the scene is our one and only Ruby and Lois. Ruby and Lois have been so dedicated to this program. So today I forgot to give them the link, and they sent me a message. Where is the link? Where is the link? They just sent me a message 5 minutes to 7. That's 7 o'clock our time. And this is Lois and Ruby. Mwah, we love you. Also, we have another child behind the stage. Is your name Josie? Maybe Josie. Is your name Josie?
Yes. Yes.
Oh, okay. Josie at the stage as well. So we are going to quickly make sure we deal with today's depression. All right. Before we start, I want to say to you all that, as you said it already, to cope is to deal with and overcome struggles and difficulties in life. So when I say cope with this thing, I mean try and overcome the issue, try and manage the difficulties. So this, to also cope, we help you maintain a mental and emotional well-being. That is how good it is. If you are able, if you have the skills, the mechanisms to cope with life, difficulties and challenges, you are able to maintain a good mental and emotional well-being. So that is the essence of coping. Now, I want to say this to you before we go straight to the kids to have a conversation with them. Depression, as we've always said, and you all know, is the leading cause of disability in the whole wide world. When you hear, oh, disability, this depression, according to statistics, is the leading cause of disability in the world. And high percentage of people all over the world suffer depression, or they have experienced a form of depression, whether it's a normal, low, average, severe depression. And I want you to know something, because most people, we use the term depression carelessly. But I want to say this as we are concluding on depression, that there is difference between a depressed state of mind and clinical depression. I want you to take note of this. There is a difference between a depressed state of mind and clinical depression. This is because anyone can be depressed. We can be sad when circumstances change. We can be angry when things happen to us. If we have low grades, we'll be sad and depressed. Our states will be depressed. Depressed means low state, emotion, sad emotion. So we can be depressed. Anyone and everyone can be depressed. However, to be clinically depressed is when your depressed state of mind lingers over and over for a very long period of time, at least a minimum of 2 weeks. You're so depressed, you're very depressed, you are not happy, things you used to do, things you used to love, you are not doing it. Some of them even go into a kind of thoughts of suicidal thought. So when you are depressed, you are in a depressed state of mind for over 2 weeks, is what is now going to be termed as clinical depression. However, I want you to note that for it to be classed clinical depression as well, it has to significantly interfere with your ability to work, your ability to play as a child, and your ability to love, because you're so depressed. You're not enjoying anything life brings to you. Your daily life activities, things you used to love, you will not find happiness in it over a very long period of time, and it must significantly interfere with your ability to do things. I also want to say to you guys that according to the National Institute of Mental Health, it takes an average, just hear this, I want you to hear this, it takes an average of, let me look at you guys again. A lot of people, let me see what they're saying. Sorry, as I'm talking, I want to know what the family are saying. So they say, please share. This is in our mind family member of the year. He's concerned with sharing. So clinical depression is very common then. Yeah, it could be very common. I agree with you, and Tajuddin. I hope you're enjoying your honeymoon. So do you know, family, do you know that it takes an average person suffering from mental health illness? I'm talking about worldwide, especially even here abroad. It takes an average person that is suffering from a mental kind of illness, whatever the mental illness is, over 10 years. Over 10 years before they seek for help. Did you hear me? I want you to hear me. It takes an average person over 10 years, to seek for help and support when they are suffering from any form of mental health. This is so sad. That is why we are having this conversation. We're having this conversation because when people are physically sick, I've said this time over and over again, when they are physically sick, quick, they go to the hospital. If they discover they are shaking, suffering from malaria, something physical, bam, they run to the hospital. If they have, they feel they are urinating blood, physical health condition, bam, they run to the hospital to seek for help. However, when they notice they are mentally unwell, they hide. They hide. They don't want people to know. They carry it. That is why the National Institute of Mental Health Center said it takes an average person over 10 years before they seek for help whenever they have mental health issue. Anyway, before we go further, I will stop here before the kids start blinking to sleep. Now, how will I start? Before I start, let me see what the family members are saying. I hear you. This is Azurike. Azurike, thank you very much. Chichi said, when they're mentally unwell, they hide. Absolutely, that's true. People don't want to associate themselves with, oh, I'm mentally ill. No, I am not, because sometimes people think that mental illness is a curse. In most African and third world countries, even some developed countries, people think that mental illness is a curse, is juju, is taboo, is something that was thrown on somebody. No, please, no, please. That is why there is high stigma attached to mental health. When you have a broken hand, it doesn't go away. If you have cancer, it cannot go away. That is why people rush to get physical health treatment. Why do you think that your mental health illness will go away if you don't seek for treatment? Why will it go away? I'm begging you, that is the essence of this program. We are trying to educate and enlighten. We are trying to remove the stigma. That is why it's good to talk about it. We've been talking about it. This is the third week. We are talking about depression in children because children also can be depressed. On that note, I want to come to Maki more. Maki, I want you to maybe greet the house and maybe, do you want me to ask you a specific question or do you have something to talk about, Maki, before I ask you a specific question? Unmute yourself and talk, Maki.
Good evening, guys. What is it? A specific question? I don't know.
All right, so I asked you a specific question. Maki, part of treatment for mental health illness is medical. Medical meaning going to take medication. Part of the treatment is also psychological. Psychological meaning psychological therapies. There are many therapies like cognitive behavioral therapy, especially when it's low or moderate kind of depression. Another is social coping skills for life. And this is what is generally advised. And also, even when it's medical, it's also need a combination. It's required. They need a combination of medicine and therapy to deal with depression. However, Maki, I want to say that if you don't have access to this, or if it's still the onset of depression, we can use life coping skills to a kind of prevent depression and or treat it or come out of it. Do you have an experience of depression, or have you used any coping skill before? Or do you want to talk to us first of all about coping skills?
I can talk to you about coping skills, and then I can give examples of either with my life or maybe the
Is this
people that
girl
I
not
know.
intelligent? You are so wonderfully intelligent. Carry on. Talk to us.
So in terms of coping skills, there's different ways that we as people used to employ to deal with depression. So for example, aside from therapy, there's things like social engagement. So one symptom of depression is demotivation. So you don't want to do the things that you usually do, and you like to isolate yourself from, your friends, your family, and things like that. But the issue with that is actually a negative coping skill. So trying your best to interact with your friends, that's something that, for example, right now I'm in Scotland, so I'm quite lonely, and loneliness is something that can lead to depressed mood. So I try to keep in touch with my friends and just force myself to, ring my friend up one day just so I can know that there's other people there with me as well. So I'm not, it lowers that feeling of loneliness that makes me feel so depressed. Another thing is just keeping on top of yourself and like go to the gym, start, finding new hobbies, finding something that you can take pleasure from. That could also help lift your mood. For my for an example of another one is religion. I think just having some sort of spirituality, because that's something that I think people forget about as well. When you're depressed, you can think that there's no positives in life. Sometimes, like for example of that, I had a friend back in university then where she was going through a very deep depression. We used to live together, and I remember her, she used to be very cheery, and she went from, being a happy, high moods, high spirit girl to, progressing to, always being in her room, never coming out, never speaking to us. And I never really knew what happened, but it was little things like maybe family issues, and, her breaking up with her boyfriend as well was causing her to feel depressed. So I seen her not interact with us, and that's the isolation thing. So she was taking aboard negative coping skills like isolation. She was also
Maki,
self-harming.
Maki, I heard you say something about negative coping skills.
Yeah.
You are the best. You see, when we talk of coping skills, people think it's good. Every coping skill is good. Actually, we have negative. I've never said this before. Maki, thank you for saying it. We have negative coping skill is anything. Anything you do to take your mind out of the difficult circumstance. However, some people indulge in alcohol consumption. When they face challenges, difficulty, heartbreak, or loss of job, poverty, anything, they go and buy either drugs or alcohol and water, or even indulge in negative. I like the way, Maki, you're an intelligent girl. Thank you. I like, and I've never said it. I'm always saying coping skill, but you just said that the girl was indulging in negative coping skill, self-harming. Self-harming. I heard you say self-harming. I never said this before. And I'm a mental health nurse. Shame on me. Maki, self-harming is some people's coping skill to not to commit suicide, but that self-harm or to relieve themselves from the tension or difficult circumstance they are in. However, self-harming is considered a negative coping skill.
Mm.
There are many negative coping skills. I just came in because I heard what you said that many of us have never said. We are like, try some coping skill, try some, but we failed. I failed to differentiate between positive and negative for coping skill. Go on, carry on, my dear.
So
I can see Ruby and Lois writing. Thank you very much. You're doing extremely well. I know you're very bright. Go on.
So obviously with all of that going on, it was very hard to reach out to her, but one of our friends, invited her to church, where she decided to go, and she spoke to the pastor. The pastor and opened up about her situation. The pastor provided her with guidance. And I think what was good for her with church was that it gave her a community, like a sense of belonging that she didn't feel before. Especially when you're isolating, that just reinforces that no one likes you, no one is there for you.
Mikey, you are using terminologies that are vital. Ruby and Lois are clapping for you. Even the family are screaming for you. They say, I'm going to UK. Princess says, I'm going to UK to give birth to my children. So help me God. Marco, you just used something. You said reinforcement. You see, these are words that are so essential in mental health, or even psychology uses terminologies like that. So reinforcement of things is when you keep doing something over and over, it reinforces. Go on, Maki, go on. You're too high class for me. Go on.
So I think the pastor was just trying to give her the tools to help her move forward in her life, which helped her, I guess spirituality and Christianity was just something that could act as a compass to lead her to the right path. When her own thoughts, when you're depressed, your own thoughts could become negative and self-destructive. So she, turning to this, it made her, she wanted to drop out of uni. She decided to come back to uni. She decided to, choose the path that she always wanted. She changed her course. She changed certain things in her life that she knew were holding her back. And so I guess I'm trying to say that, sometimes just finding a community and a space of people that can give you a different point of view that you might not be able to give yourself is a great coping mechanism for depression.
Marky, I'm so sorry. I keep jumping in. Marky, I remember you sharing a story of a friend of yours. Is it this person?
Which one?
There was a time you shared a story that I see a likeness to the one you're sharing now. A colleague of yours, and your difficulty to relate with them, and you wanting to go forward. Is that the same person?
I'm not sure. I don't think so.
There was a colleague of yours you said was, isolated, this, not engaging. Then I told you to calm down, look deeply. She may be having a mental health issue. Is it that?
I'm not sure.
Your mate. I don't want to really define it deeper. so it won't be exposed. The one you shared with me and shared with me some messages, some text messages.
Maybe I'm not sure. I don't think it's.
I think with the story you're saying is related to that. I'm not saying her name. I know that's what you don't want us to say. So I know it's that person because it's similar. And I told you, take it easy. She may have a mental health issue. Is it not
Mm,
that?
maybe I
Correct.
think so.
Continue.
Um, I think I've said most
Yeah,
of my parts. So
yeah.
if the other wants to speak on there, just so we can get it to 1 hour. Just think about
Yes,
time.
I agree with you. You're wonderful. Maki is a very principled person, so you can mute. So, Maki, you've said a lot. You've said a lot. And I want to say this to family. And family, before I come to the little ones one by one, I want to say that um, fear of failure, because most you talked about your friend in university, breakup of with her boyfriend, and a whole lot of little things. So sometimes it could be breakup of relationship, it could be grades, it could be grades, it could be really it could be anything, maybe bullying. It could be anything and anything. You can't say this is what causes depression. No, it's anything. And sometimes something you can manage well and come out victorious, another person may fall when the same thing happens to them. So it depends on the person as well. So anything can cause depression, especially negative things like loss or heartbreak and what have you. I want to also say, parents, in addition to this, fear of failure by our kids, pressure. Sometimes parents, we, including me, we give our children pressure to perform well. We want them to be the best. High expectation of parents for their children. We want you to come top of the class. We want you to do medicine. We want you to be a doctor. We want you to be a science. By putting a lot of pressure on them, and themselves having fear of failing the parents is a very high rate. It causes depression in children. That is why you can see some children, when they go to uni, they are not going there to do a course they like. They go there to do a course the parents pressurize them to do. We have a lot of graduates that graduates from university and they are not working with their certificate because that is not what they want to do. But the pressure from parents, the high expectation from them, the fear of the children to disappoint their parents, always, sometimes in some children, it causes depression. Again, this ranking of grades in school, when you see children, the fear of failure, it gives some children depression. Some children suffer anxiety, depression, panic attack, stress. They have fear to fail. They have pressure to perform. It gives them depression. Also, children are scared to death. Children are scared to death to disappoint their parents. Parents do not even allow children to choose what they love to. In fact, there are some parents that force adult children to marry who themselves, the parents, choose for them. Hell, Jesus, how can that be? How do we do such things? Parents, I honestly don't know where to start. You force a child to do some subjects, they are not happy. They will say to you, I don't like this subject. I like the other one. They say, no, you have to do this subject because that is what you have to do. We all do it. Apart from this, you will see parents as an adult, full-blown adult. The parents will say, you have to marry this person. How? How will you do that? How can you do that? How can you force a full-blown adult to marry someone they don't love. You say love is not important. Started when? Parents, we need to allow our children to choose what they love to do. All we need to do as parents is to guide them and support them. No matter their choice, they can succeed in that. We need to start. I'm so happy for parents of today. Look at the children. They are by themselves. Formerly, you see a parent close to the child. We say, we want this talk show to be with children. A parent will go and stay near the child. And say, can you keep quiet? That's why when I hear parents talking for the child, can you keep quiet? Let us hear what the child wants to say. It's high time parents stop talking for the children because you don't even know your child. By talking for your child, you fail to listen to the child. It's high time we started listening to the children. The voice matters. Children's voice matters. Let me tell you what this does. By the time we start choosing and picking things for our children, they now start getting angry, depressed, frustrated, anxiety. They are scared to disappoint you. What do? They start indulging. They start taking substances to quench their temper. They go and start smoking, drinking, taking drugs, looking for something to do to take away the tension. Is that what we want from our own kids? You see them, they start committing crime, they are angry, they take that anger on another person. They become violent, they are sad, they are traumatized, they are not enjoying life. It's time for us to campaign for us to start to campaign for young children. Young children, young people and children also have a voice. Lois, can you unmute Lois? Can you relate with what I'm saying?
Yes.
If you are to talk to parents, I know you've spoken a lot to parents. If you're to talk to parents without looking at book, talk from your heart. What will you say to parents as a child?
It's good to be strict, but being too strict can have an effect on your child. But yeah, that's it in short words.
So that's, you said it's good to be strict. Listen, we all need to be principled, strict. It's absolutely important. We all need to guide our children, but there is difference between being strict and guiding our children from speaking on their behalf, talking for them, making their choices. Like that's what Lois is saying, being too strict. Being the person to make a decision for your child is not good. So, Ruby, I hear you whispering. What do you have to say?
Yeah, it's good to be strict because you're like training your child to be strict. I mean, not to be strict. Because like if they go out into the outworld and someone shouts at them, they'll be used to it and they won't get like sad. But if someone's like always so nice to them, and if they go out to the outward, if someone shouts at them, they're just gonna be crying all day.
Oh, wow. I'll mute you for 1 minute. Did you hear Ruby? Family, did you hear Ruby? Ruby said it's good to teach your child life coping skills so that when they go outside in the outer world, for instance, if your child fails an exam, she didn't say it this way, but that is what Ruby said. Invariably, if your child fails an exam, they will be sad. Give them the coping skill to know how to deal with it, to come out of sadness. Maybe you take them for a walk, you cook with them, you sing, you get them to do things they love to do, and you talk to them that failure is okay. What do we do to pass? It's okay to accept failure. However, However, she said, so if they go out, because if you're always crying with them when they fail, they cry, you cry. Then when they go outside to meet the outside world, Ruby said, if you keep pampering them and not giving them the skills they need to cope with difficult circumstances, if they go to the outer world and if they encounter difficulty, they will not be able to cope. Ruby, thank you very much. Lois, thank you as well. I'm coming to you guys. Maki, do you want to say something? Let me go to Michelle. Michelle, can you please unmute and talk? Michelle, you heard all we have said.
Yes, ma'am.
Can you relate? Can you relate with what we've been saying?
Yeah.
Talk to me.
I'll actually agree. Being strict is part of life for parents to train their children in order for them to start up for themselves one day. So they won't be messed around with. That is the essence of being strict.
Fantastic. Fantastic. Thank you very much. So, Michelle, we are talking about depression and we are talking about coping skills. Do you agree with me that have you felt depressed before, or do you know anyone that have felt depressed before?
I felt depressed before.
Do you want to share?
Okay, so my depression didn't reach up to 1 week. It was a 4 days depression.
So that means you've had a depressed state of mind before.
Yes.
What do you want to share what happened or not? You don't need to share if you don't want to.
I'd love to share.
Share then.
So it happened when I was in GS1, since I'm in SS1 now. It happened when I was in GS1.
Mm-hmm.
The
Yeah.
depression was about my weight.
Okay.
Since I was being made fun of my weight by a girl, I was being bullied by a girl of my weight, that I'm too big, I can't run, I can't play, I'm not fit, this and that. And I felt really, really depressed about it. I kept crying and kept it to myself, expecting that I will hope to find a solution until my mom asked me, how are you? How are you feeling? I told her that I was not alright. She asked what happened. I told her that I was there's a girl in which bullies me at school about my weight. She was like, I shouldn't bother about it. That is nature. That I will later reduce. That she's just running her mouth. So my mom later found an herbal concoction, a herbal mixture, which naturally helped me in reducing my weight to get my normal shape back. Since then, I wasn't made jest of. My mom told me that always stand up for yourself. Never allow anyone to bully you. Speak up, stand up, be confident. Since then, the bullying stopped.
Fantastic. When you say the bullying stopped, do you mean she stopped bullying you or you overcame, you didn't care about her bullying anymore?
I overcame it. I didn't care about it, and she stopped.
Fantastic. So part of overcoming bullying, we are talking now about bullying, is not allowing yourself to come down when you're being bullied. Stand up for yourself. Report.
Yeah.
Go. Continue to be yourself. I know you said she gave you herbal things you took and you gain back your shape. Let's imagine you never gain back your shape again. Anywhere you are, you need to accept yourself for who you are. Accept yourself for who you are, however you are. I know it's difficult. It's easier said than done. But there are some people, due to one circumstances or the other, they may not actually be able to come to the regular shape. We don't want them to be depressed based on what people say to them. So that is the essence. As Maki was talking about life coping skills, just like you accept, you were confident, but I heard you say you were confident because you took some herbal drinks.
Sure.
Yeah, which is not bad. It's good because you worked on yourself. That's fantastic. But let's not allow bullies to bully us into shaming our body. Your body, be proud of how you are. However, like me, I want to be slim. But that doesn't mean I am so look, if I'm walking, I'm dancing. If I put one step, I dance. I am so happy with myself that I can kiss myself. Mwah. I kiss myself. I walk on the way I carry myself. The way I carry myself. People call me and say, take it easy. You love yourself too much. Yeah, that does not mean I don't want to slim down. I want to slim down, but I love me for me. So, what if, for instance, I'm being cursed? Look, get out of my sight. I love myself. Get out. I like the way I am. I will be walking confidently, majestically, and dancing in between. Don't let anybody body shame you. Don't do anything outside ordinary to get people to like you. Be yourself. The first treatment for such bullying is self-love. You kiss yourself. Even if I can't physically kiss myself, the way I carry myself, my daughter knows. My daughter knows. Anybody I go, even sometimes when I'm walking, people say to me, I like your confidence. I like your confidence. I don't say I have confidence, but they see it. So however you are, carry yourself. Love yourself. If you don't love yourself, nobody will love you. But I heard you say you had more confidence when you lost weight, which is okay. But whether you lost weight or not, don't let anyone to put you down because of how you are. Me, first, I love me. Love you.
Yes.
Love yourself. Don't let anyone to shame you. I want to go to Josie. Josie Eze. Good evening, Josie, my darling. How are you doing?
Good evening, ma'am.
How are
Fine,
you?
ma'am.
Fantastic. Josie,
Fine, ma'am.
how old are you?
12.
Wow,
I'm
wonderment.
12 years old.
I hear you. Josie, you've heard what we've been saying.
Yes, ma'am.
Are you learning? Did you
Yes,
learn
ma'am.
something? Did you learn something from what we are saying?
Yes, ma'am.
What did you
Yes, ma'am.
learn? What did you learn?
I learned that it's good to put yourself together in any way your friends or your schoolmates are bullying you, that you should put yourself together. Make sure they don't depress you.
Fantastic. Put yourself together. Love yourself. Feel good about yourself. Look, I want in our mind kiddies, Nurse Angel kiddies. I know you're part of Nurse Angel's kiddies corner. Whenever you're walking,
Yes, ma'am.
be dancing. Be dancing. If you're walking, walk as if you own the world, but don't use it against anyone. Don't let
Yes,
anyone
ma'am.
put you down. If you're walking, huh? Hey, wahala, let me tell my camera to start. If you're walking, huh? Like you're a guy, you're walking. You know, who won't try? Huh? You're walking. If you're walking happily like this, even if you're like that or you're like this, no one can talk to you. Trust me.
Yes, ma'am.
Listen, if you're walking like Jesus. I love myself too much. Oh. Eh? And what? People will be like, wow, this guy, have you seen how he's walking? He's so full of himself. He likes himself. Yes. If you don't like yourself, who will like you? But if you're walking like this, it's easy for them to bully you, to shame you. If you're walking like this, it's easy to shame you. But when you're walking, and you're happy. Like me, whenever I'm walking, I'm smiling. People like, she's too smiling. Yes, I'm happy. So both Josie and Michelle, I want you to know that first, self-love. Self-love. I will mute you. Josie, is there something else you want to say?
No, ma'am.
Fantastic.
No, ma'am.
So I will mute you. And it is right now, it is 8 o'clock. I have disciplined myself and I said to myself, I will always keep to time. Mute yourself, Josie. So on that note, I want us to start wrapping up. In wrapping up, I want to go back to Maki. Maki, unmute yourself.
Hello.
You have shared with us life coping skills. You gave us examples of how people turn to religion to cope with life issues, how people go for exercise to cope with life issues. Is there something else you want to say to us? For instance, as a child in the university, is there something you want to say to parents regarding what I've said? I say that sometimes parents, including myself, we push children a lot to do things we parents want, not what the children want. Is there something you want to say to parents on that regard as a child yourself?
I guess I don't know how much I experienced depression from that, but there is a sense of when you put too much pressure on your future, especially at such a young age, where you have to choose a course that is determining what you're gonna be in the future. Putting all that pressure on yourself could make someone be stressed out, which can cause them to feel depressed in the same way. So I guess I'll just tell the parents to understand that your child is going through a phase in their life where it's one of the most important years in their life, to take it easy on them, to understand that if you want, there's no issue with guiding them and giving them advice, but to forcibly impose what you want on them when this is their future, it can cause them to feel some sort of, and especially when you put high standards on them and you're pressuring them to do as good as when they're trying their best, it can also make them feel inadequate, which can cause depression in them. So watch out for that.
Fantastic. Maki, your terminology is next to nothing. That's your terminology. There is nothing in front of your terminology. I can't even remember what you said, but you said something that hit. You said that is important for parents to advise. I agree. I know, Maki, you are my daughter. You are my daughter. From birth, you never allowed me. From birth, family, Maki never allowed me to do her homework, to tell her what to be in future. She look, I am a bad parent. I wanted to come. She just pushed me out from nursery school. Even when she's doing ABCD, I'll come and say A. She say, Mommy, please, I want to do it myself. There's a way the teacher taught me. I want to go with that phonetics. I said, please let me teach you. She refused from childhood till tomorrow. She refused for me to interfere in her learning and career. Maki is in university. She writes a lot of essay. I love her. I'm distinguished in writing. I will say, Maki, give it to me. Let me proofread. She said, no. Don't worry, when I fail, I will learn from the teacher will tell me things. Sometimes she will show me. Maki will bring her essay when I insist. Let me see it. I won't change it. Maki will bring her essay. She will hold my hand. Maki, do you want to talk about it? Maki will bring her essay to me. She will say, Mommy, read. She will hold my hand from typing. She said, read and tell me what you think. She will hold my hand. My hand will be held by Maki and I'll be reading essay. Look, Maki really dealt with me as a mother. She refused me to interfere. I asked her, Maki, what do you want to be in future? She said, don't worry about that. Maki, what do you want to be in future? Mommy, don't worry about that. I'm thinking. She did everything herself. This girl is so well organized. I called her yesterday. Maki, do you want to appear in the talk show today? She said, Mommy, you don't just interrupt my plan. I have a plan. If you want me to appear, can you give me 1 week's notice? I said, okay, please, please. She said, I need to. You know what you told me? What did you say to me when I called you yesterday night to tell you, please, I want you to appear? What did you say?
I said, give me a notice or give me some time. Let me decide.
You said you need at least 1 week's notice.
Yeah.
I said, please, Mikey, it's depression on children. Please, you will help people. You will save life. You will do. I started preaching. You said, okay, just give me some things to look at what you're talking about. I sent you the part 1 and 2 video, and you said you will look at it before you give me a heads on whether you will do it or not. So when I told you, then I called you today. You say, Mommy, please, can you send me a text message? I'm doing things. You're interrupting my work. You see, the girl is so organized that I called her the first time, she answered me. I called her again. She said, Mommy, please, I'm working. I'm doing my work now. Can you send me a text message? When I'm free, I will read it and respond. So why am I saying this? I heard you say parents can advise, but don't choose. Parents, we can guide, we can advise, but you said don't choose by imposing things on them. And there are certain other things you said, which if I go back and watch the video, I will see. Thank you very much. Lord, you can mute Maki. Thank you for the advice for
No
parents.
problem.
Yeah, and you talked about how it affects them as well. Lois on mute. Ruby, unmute. Thank you. So, in closing, I want to say that last week, on the part 2, Lois shared a lot with me. So currently, we are still working on it. I told her to give me the name of the teacher, the name of the principal, the name of the board of the education in the school, the name of the school, the phone number, and also I'm talking to her because I don't just jump into things. I'm doing a lot of discussions with my Lois. I've opened a group page where I added Lois. We are communicating on a regular basis. So she's talking, a lot is coming out. So I want to first of all assess. After assessing, I'll be able to know what is happening. So that is what has been happening so far. We've been doing, and I've been giving you coping skills on how to face people and so on. What do you want to say about that? After appearing and speaking to us on the talk show, what has improved so far, Lois?
I am learning different coping skills to what I had before, which was a negative coping skill that I realize now because of Mackie, such as like picking up my scalp, which is why I'm developing like a bald spot that I didn't like, but I still did it. And also about like I wrote it down as well. Also about like the parents projecting onto their child, like not to like hate on my mom or something, but whenever I used to study, my mom would always double check my work, and she said she wouldn't sign it until she double checked it, and then she'd find a lot of mistakes, and then she like correct it and make me do it on my own, but I didn't understand it. And then when I go to school, I would get 10 out of 10, but I wouldn't understand it until I made up a lie, and I told my mom that I said my teacher wants me to do it on my own, and that you should stop tracking my work. And then when I went to school, I started getting 6 over 10, 4 over 10. But then my teacher started helping me, and from that point I started getting better. But it was also a bit too late, which is why I'm also doing better in secondary school than in primary school.
Fantastic, fantastic. So this is amazing. Thank you very much. As I said, we will still get to the bottom of the bullying and everything. We are still talking, and you're telling me a whole lot of things that are happening that made you develop what you have developed. So, Ruby, how are you?
I'm good. How are you?
I'm fantastic. Thank you for asking. So, Ruby, I want to ask you, what do you have to say to children, your mates, regarding not putting in terms of preventing depression? What advice will you give to children to prevent depression before we go?
You guys should ask for help because you won't know their answer if you don't ask for it. So basically,
You always talk about speak up, and you're still talking about speak up, and I agree with you. Go on, Ruby. Go on. Is there okay? I will ask you a particular question. If someone comes to you and tell you that they are depressed, what will you say to them, Ruby?
I'll be like, oh, are you okay? I'll try to find a way to help them. I'll maybe tell them about Childline. I'll ask them all their problems. I'll be like their own therapist, you know. And
Fantastic.
then
Thank you very much, Ruby. Absolutely amazing. Michelle. Michelle, can you unmute, please? Michelle, what do you have to say in closing? In closing, what do you have to say?
Mm, I would say people that are depressed should try and speak up and be confident, no matter the situation. Speak up to the right people, no matter, and yeah, that's all.
Fantastic. They keep saying, speak up, speak out, do this. So, parents, please note that. Just note that depression is a condition, just like broken arms and cancer. It's a medical condition. It is not witchcraft. It is not voodoo. Please, I am begging you, stop hiding from depression. If your child is depressed, if you find out, I know children can hide, but that is why you're their parents to speak to them. Please speak up. Do exactly the same thing you would do for children that are that are physically ill. In closing, I want to remind you we have a lot of sources to support us on depression. If they are very severely depressed, please take them to the hospital. Please. If they are mildly depressed, please give them life coping skills and work with them. Positive. We talk about coping skill. Maki said positive for coping skill, not negative. Again, in all, always add both in the coping skill therapies, even when they are taking medication therapy. Remember, go to your doctor if you think your child cannot cope, and if you think you don't have the means to support them, go to your doctor. Mental health illness is an illness. It is not a bad thing. It does not mean you're a bad parent. Seek for help. Depression is curable. Depression is curable. And the earlier you start treating depression, the easier and more successful you can. Thank you very much. And I want us to, who wants to, Maki, do you want to dance? You don't want to dance. You want to dance, Maki? All
Excuse me,
right.
ma'am.
Yes. Maki, I've put you at the backstage. Yes, go on. We want
So
to.
before we close, I would love to appreciate you again for the opportunity, uh, letting me to join you at the backstage for the Los Angeles Kiddies Corner. I'm grateful, and also for the support, care, and love you showed to my mom late last year during our surgery period. I'm so grateful. May God continue to bless you.
Mm. Thank you very much. Thank you. Thank you, Michelle. You're the best. All right, it's time to dance. Who wants to dance with us, Angel? So please mute. The last time you did not mute. Please mute. I've muted you, don't unmute. Lois, wonderful. Stand up and dance. I need to activate my AI. AI, come with me. If you don't come with me, that's your business. As long as you can show me at the back here. So, who wants to dance? If you don't want to dance, I take you to the backstage. Who wants to dance? Let us dance and close.
For more Nigerian music anytime, anywhere.
Yes, so okay. Ready to close and
No time, na bracket today. Night they come today. Bitter and born and talk for no time, That's why me I say make I am to the thing where they vex me, Now the same thing where they vex me, For this world, the good they die, and for the bad, I think they survive. See I don't try, make I ask God why. It can't be like see I dey waste my time. Oh yeah, everybody make una the jolly, Make una throw una hands in the air. If you want to go to make you go there. We got to some people go scatter your brain. Now this thing where they make me go low, go low. This thing where they make me go low, go low. I say that this thing where they make me go low, go low, go low. This thing where they make me go low, go low. This thing they make me go low. Better thing, not the last year. If you dey hear me, no doubt me, Believe me that I do for you, but like everybody don't die, See our name na the bracket, Before we do dance on happy day, but now we talk about the yoli, I say everybody make una the jolly, Make una throw una hands in the air. If you want to, make you go there. Cause you got it, some people go blow up your brain. And this thing where they make me go low, go low. This thing where they make me go low, go low. I say that this thing where they make me go low, go low. This thing where they make me go low, go low. Una see, as Peter and Paul and Bracket, they don't they go. I remember when we do it, they do last night, then they don't go low. Them say, we no service in here. Some say, not only dance with the dance here. We can't bring back busy body here. Temptation, they say, I copy here. Go back again, we bring to me, and go today. With a good video, what they will make me here. Now this thing where they make me go low, go low. This thing where they make me go low, go low. I see that this thing where they make me go low, go low, go low. This thing where they make me go low, go low. Everybody Oh, no time, no time, better thing, not the last year, not the last year, no time, better thing, not the last year. Na bracket today, Peter and Paul, don't follow, If we do you, why make una the jolly, Make una throw una hands in the air. If you want to make you go there. Without you, some people go take you over there. Now this thing where they let me go low, go low. This thing where they let me go low, go low. I said that this thing where they let me go low, go low. This thing where they let me go low, go low. Now this thing where they let me go low, go low. This thing where they let me go low, go low. I said that this thing where they let me go low, go low. This thing where they let me go low, go low. Now this thing where they let me go low,
Hey, wow, this is my coping mechanism. This is my coping mechanism. Yes, so family, we want to start being strict. 1 hour should be 1 hour. Today I went above it. So in closing, Maki, I'm bringing you up. I want every one of you, I'm unmuting you to say bye-bye. I've unmuted you all, apart from Ruby. So can we say in our mind, it's always in my mind, and your destiny is in your hands. All right, Nisha, let me hear you all say it.
I don't know.
In our
First time
mind, always
she
in
could
my
come out.
mind. Do remember, your destiny is in your hands. May God bless in
Fantastic.
our mind.
Fantastic. And Lois, Ruby, can you say it? Ruby.
In our mind, it's always in our mind. Your destiny is in your hand.
Mikey, I know you've not heard this before. Do you want to say it to us? Or
I don't mind. In our mind is always in our mind. Your destiny is in your hands.
all right, next time when you come, you will say it like this. In our mind is always in my mind. And
Okay, yeah.
your destiny is in your hands. Thank you, family. I love you all. See you. Thank you, Ruby. Thank you,
See you.
Misha.
Bye.
Thank you, Mike.